So can you work full-time in nursing school? Stay tuned to find out. So I did get this question quite often in my inbox. If you can work full-time in nursing school. Those of you guys who have followed me for some years now know that I worked full-time through my LPN program, my RN program, and my BSN program and my MSN program. So the short answer is, of course, you can work full time and go to nursing school, but there is a caveat to this question. Now, the reason why nursing programs are resistant to you working full time is because they feel like it may decrease your chances of you passing the program. And then therefore decrease the chances of you passing the NCLEX. So it's all evidence based. You know, people that don't work a full time job or only work part time have an increased risk of passing the program, and also have an increased risk of have increased chances on passing the NCLEX. But I will say this: working full time and going to school full time and in a full time nursing program will kick your ass. There's no lie. There's no way around it. Those of you guys who have followed me for these years, go back. You guys know my Confessions of a Nursing Student video. That video is like 12 years old now, but that is when I was working as a CNA in my LPN program and was stressed the fuck out. Okay. Now I will say this, that if you are an adult who has bills like I did at the time, you really don't have a choice but to work full time. Now, those of you all who have to work full time and you also have like kids and stuff like that, now that's when it gets a little sticky, because I know that being a mom or being a parent isn't a full-time job. So working full time, going to school full time, and also having to be a full-time parent, I just don't see how that's really possible. Not saying that it's not possible, but I just don't see how that's possible for you to do all these things. Because mind you, I was a single male. So I had worked full time and I went to school full time. So those were my only two elements at the time. Now, no children, no other crazy responsibilities. I wasn't taking care of a parent or anything else like that. So those two factors were enough to really fuck me up. Now I will say this: if you are going to work full time, which I'm pretty sure a lot of you guys are, if you don't have some type of a support system or somebody that's helping you with your bills, or you living with your parents, or let's say you're married and maybe your husband or your wife is taking over the majority of the bills for the amount of time you're in nursing school, or you have supplemental help in there somewhere, I don't recommend it, because it is very, very difficult to do this. I did it. Mind you, I was in a whole different headspace. Like, I feel like if I didn't work full time, now this is just my craziness, I feel like if I did not work full time, I don't know if I would have made it through nursing school, because I went immediately into grind mode. Like, I was like hustle mode, grind mode. Like, my typical days, and particularly in LPN school, where I worked night shift as a CNA, so I worked from 11 to 7, got off work at 7 a.m., went to school from 8 to 2, or on clinical days, I had to leave work early to make it a clinical from 6 to 2. So, and then I would leave, get home, try to find some time to study and sleep, and that went on for days at a time. So that shit almost had me with a nervous break. Like, almost had a nervous breakdown. So it's absolutely doable, but mind you, you have to be so strategic with the way you spend your time. You have to set yourself up for success. You have to have a support system, not a financial support system, but families and friends that are supporting you through this process in order to complete this. There was a video I did a few years ago where I mentioned, like, I literally use every minute of every day to I was efficient with my time. Like, I optimized every moment of every day. Like, I remember there was somebody saying that I remember taking pictures of my notes on my cell phone, like my like school notes, like my A&P notes and all this stuff on my cell phone. So if I had a minute of time, let's say like I was sitting in a drive-through, or I was sitting at the bank, or I was at a doctor's appointment, I had my notes on my phone. So literally no moment that I had of quote unquote free time went to waste. So you have to really be efficient with your time. You really had to, I had to optimize every moment of every day, because I knew that for I was getting ready to go to school or getting ready to go home and go to sleep. So long story short, you can do it. It will be difficult, but if you are determined, if you have passion, if you have a plan, if you are a self-starter, this can absolutely be done. You can absolutely work full-time and go to school and be in a full-time nursing program. Is it advisable? No. But can it be done? Yes. Thank you guys for tuning into this video. If you guys have not already done so, please follow me on Instagram at Adam Deshawn. Please also like and subscribe to like this video and subscribe to my channel. Those of you guys, and also you guys tell me if you worked full time and also was in a full time nursing program. Comment below some things that you did that have you guys make it through the program. Until next time, happy nursing. Bye.